Hi class, this is Arthur Burton and this is for class HCA415. And today we'll be doing advocating for a public health policy in regards to HIV/AIDS. The HIV/AIDS virus affects our community and all of the world that's around us. The AIDS epidemic is a standout amongst the most crucial infectious diseases and emergencies of our time. It attacks families, groups, all throughout the world, and it doesn't discriminate between age, race, or sex. In 2005, more than 25 million individuals have died from the HIV/AIDS virus, and an expected 39 million people are actually living with the HIV virus. Another 4 million individuals were recently contaminated in HIV in 2005. Now, while Africa has been the hardest hit, there are different areas of the world and communities that are finding that many people who are living with the AIDS virus, they haven't been identified because they cannot afford medical care, so they haven't went to the doctor, and no reports have been drawn. The impact for our community, though, is twofold. One being the lack of education provided about AIDS to our young adults by the school system and the parents. Our children need to be educated on how they need to protect themselves from this very, very dangerous virus. The second thing being that because our community is one of the more poorer communities, most of the people can't afford to pay for health care. They can't afford to pay for health care. They don't have the money for the co-pays of health care, and some of them have no medical insurance whatsoever. So what that does is it makes our community more vulnerable to the virus because many of the residents are living with HIV, some know and then some don't know, and they're still sexually active. There is also another issue, and that is the lack of educational information at the school level being brought and taught about the disease. So there are many sexual education classes, but basically it doesn't go into deep detail about HIV disease and how for people to protect themselves and how to be safe, as well as like self-testing. There are many avenues that a person can go to be and give themselves a self-test for HIV via Rite Aid or Amazon. They sell a lot of kits. But the problem is that people, they're unaware of this and they don't know about this. I think legislation should take the lead on preventing HIV and treating HIV. But they also should be concerned about the education of the young adults that are at school level that aren't aware of how important it is to protect themselves and to have safe sex at all times. Now, even though there's no cure for the HIV disease, there are powerful antiretroviral medications that can control the infection. If we could just address the issue through education and the training for our community in clinics and in schools, this would be a very effective resolution. I say this to say that in order for us to accomplish this is that we need a policy created and we need a substantial budget created so that we can start up these programs, and these programs are going to be well worth the money because they're going to save lives. Now, HIV, it affects everyone, and we need not to be concerned about our profits and have our profits overshadow the need to produce generic drugs for people suffering with HIV. There's a presidential candidate, Bernie Sanders, who mentioned a policy called the Prize Fund. This is a perfect example of a policy that needs to be set in place. This policy would not only help educate people, but it would also remove the rivalries and the competitiveness of the pharmaceutical companies when it comes to creating HIV drugs. As it stands now, antiretroviral drugs, they're really too expensive, and most people that are infected, they can't afford it. Our policy would allow the production of generic drugs at generic prices so that we can distribute the drug to HIV patients that are in our community at a price that they can afford. This change will not only get the drug to people that need it, but by getting the drug to people, this can educate them and educate our young adults, educate our community on how to keep them safe, and hopefully they will not contract the HIV virus. Now, of course, with every policy there are cons, but I believe these cons will pay for themselves in the future. If we were to allow too many companies to sell the AIDS medication, that's where the competition comes in, and that's where we start seeing elevated prices. And those elevated prices, because of the competition, will kind of set a boundary that, okay, we're selling ours for $200 per pill, and the other people, it will only fluctuate maybe $10 down or $10 up, and that wouldn't be sufficient. Now, if we don't enact this policy, what we're doing is we're condemning the lower class people to death. Because without medication, when they contract HIV, they're not able to live a long life because the virus will eventually kill them. Now, if we do enact this policy, the lives of everyone will benefit through education and being able to safely have sexual relationships with each other because they will be informed. During the Bernie Sanders campaign for president, I mean, when he began speaking about the prize policy and that budgeting we put in place for generic medicine, I think it was kind of, when he was not a candidate anymore, it was kind of pushed to the side. But we really need to look at this. This campaign would help millions of people that are infected with the HIV virus. This would also allow people in the poorer communities to be able to afford the much needed HIV medication. The most important thing for legislators to realize is this option is a great resolution to stopping and the spread of the HIV virus in our communities. And then from our community, it stretches to other communities, which stretches to be a worldwide resolution. And for those who are not in favor of this policy, I would just like you to ask yourselves, what would happen and how much would it cost if the AIDS virus became like the bubonic plague and killed a large percentage of the population? The result on our economy would be devastating, because there would be millions of people who can't go to work. There'd be millions of companies who can't hire qualified people, and there'll be millions of products that can't be sold, all because we allowed an epidemic to overtake our population and to destroy the economy that we have built. The result of the economy, I want to say, would be an economical downfall. The economy would actually crash because there is not enough people to do the jobs. There is not enough companies, because the companies will fold. I mean, companies are built because people go to work, and as people work every day, the more people that work, the better the economy grows. So I really want you to think about it. We can sacrifice a small dollar for today by investing in these HIV programs that are going to educate our young adults, be placed in clinics to educate our adults who may have or may not have HIV, but it will also teach everyone how to be safe and how the importance of healthcare really is. That most issues can be mandated, especially with HIV. A person catches HIV, they get their medication, they're treated, they can live a normal life, and it doesn't only make their life healthier, it makes our whole community's life healthier. Because at this point, we're able to really understand that there is a problem, we're addressing the problem, and we're doing a resolution for the problem. Once again, I would like to say thank you for taking the time to listen to what I believe is a great, which I know is a great policy, and this policy can only be built on and grow stronger and stronger, and it can help everyone in our community and in the population. Thank you.